What I'm going to show you is the psychedelic assisted therapy, the science behind the shift, understanding what's actually happening in your brain and why it matters. This is a very important topic that is circulating in the psychology world, the coaching world, where people are now trying to use this type of method. So I'm going to break it down for you guys step by step, so you have no confusion. You're going to understand everything about the psychedelic assisted therapy. So let's get into it, guys. So what we're going to explore is how it works, the full process, the integration, the recreation versus therapeutic, why context changes everything, why SSRIs fail at times, because it does work, but why does it fail at times, red flags versus reality, right, guys? So what exactly is the psychedelic assisted therapy? So simple definition, guys: the supervised use of psychedelic substance, like this word is long, guys. So let's see how best we can pronounce it. Like like psilocybin, like the psilocybin magic mushroom, like the magic mushroom, MDMA, or ketamine, within a structured therapeutic setting, guided. Okay. So simple definition, guys. This is the supervised use of psychedelic substances like the magic mushroom, the MDMA, or ketamine within a structured therapeutic setting, guided by trained professionals to facilitate deep psychological healing. So the key players, we have the magic mushroom, that is FDA breakthrough therapy, depression, anxiety, addiction. Then you have the MDMA, ecstasy, and you have Mali, FDA breakthrough therapy, so use this for PTSD, trauma processing. Then you have the ketamine, right? Already legal, available now in clinics, treatment resistance for depressions, treatment resistant depressions. So why is everyone talking about this now? So a brief history is like 1950s to 1960s, promising psychiatric research that had some research done back then. And in 1970, Nixon banned psychedelics, politics, not science, right? 1990s to the 2000s, research quietly resumes. And then in 2017 to now, FDA grants breakthrough therapy status. Right, and then from 2024 to now, it becomes mainstream acceptance, accelerated a little bit more. The research says that 60 to 80% of patients now significantly have improvement. This was done by research in Johns Hopkins, NYU, Imperial College London. Right, effects last months to years, not hours. Works for treatment-resistant cases. Single sessions can equal years of therapy. That's like a wow. What it's being used to treat. It treats treatment-resistant depression, PTSD and trauma, anxiety disorders, addiction and dependency, end-of-life distress, right? So how psychedelics actually work? So how does it really work, guys? So the neuroscience behind why this isn't just getting high, right? So yeah, and that's what I want to make sure that you understand. This is not just you're going to get high and like, all right, I get high and I'm healed. No, this is therapeutic, right? So this is the neuroscience behind it. So they have something called neuroplasticity, the brain ability to rewire itself. So psychedelics increase BDNF, which is essentially fertilizers for new neural connection, right? This is why insights can actually stick. All right. Now, and then they have the default mode network. All of this is happening in the brain, guys. The inner critic's headquarters, responsible for rumination, overthinking, and constant mental chatter. Psychedelics quiet this network, breaking rigid patterns. So think of it as a reset button for stuck neural pathways. So So, and think of it like fertilizers. When it comes to the neuroplasticity, like pouring fertilizers in a plant. So you're pouring fertilizers for new neural connections, and then for the inner critic headquarters, psychedelics quiet this network, breaking rigid patterns, right? So your brain on psychedelics. So normal state is like you see the dots right there, rigid, predictable pathways, some thoughts, some loops, strong inner critic activities. But when it's psychedelic state, your novel connections form. So you have novel connections, rigid patterns dissolves, right? I can see things more differently, right? So you don't want those rigid patterns. You want to see things differently. So this increased connectivity explains why people see their problems from outside themselves, right? So when you have more connection, you see the problems outside of yourselves. The critical difference: why set and setting changes everything about outcomes. Recreational use, unpredictable environment, social party setting, no intention or structure, unknown substance purity, no professional guidance, no integration afterwards. All right, escapism mindset, escape, just want to escape. But when you use it as a therapeutic use, safe, controlled environment, trained facilitators present clear therapeutic intention, medical grade substance, preparation sessions before, and integration sessions after, and healing mindset, right? It's like a healing mindset. What a therapy session looks like. Okay, so one, you have preparation. This might happen like 2 weeks, sometimes 4 weeks. Medical screening, intention setting, building trust, coping techniques. And then you have the session, 6 to 8 hours, right? Control setting, eye shades and music, therapist present in an exploration. And then you have the integration, weeks to months. You have processing insights, finding meaning, real life changes, ongoing support, right? The session itself is just 1/3 of the work. Preparation and integration are equally crucial, all right? Why SSRIs often fail, right? But I know they work at times, right? I have clients who were on it, right? So it does work, and there are and then some individuals take longer for it to work, or some doesn't work at all. Why psychedelics might work when traditional medications don't. SSRIs manage symptoms, not root cause, right? Manage symptoms, but not root cause. Dampen emotional range, requires daily dosing. 30 to 40% don't respond. Withdrawal challenges don't change patterns. Psychedelics now address underlying patterns, right? Expand emotional access. Few doses, lasting effects. 60 to 80% show improvement. No daily dependency. Create new pathways. Important, this isn't anti-medication. SRIs help many. This is about options for treatment-resistant cases. That's why I'm stressing that SSRIs do work for some cases. The therapy around the substance matters more than the substance itself. All right. So why integration matters? Insights without integration equal interesting experiences. Insights with integration equal lasting transformation. Integration with the therapy, right? Integration includes processing emotions, making a meaning of insights, translating to daily life, nervous system regulation, ongoing therapeutic support. So this is where coaching and nervous system work becomes essential for this type of treatment. Red flags, guys. So here are some red flags. So this is absolute red flags. Personal history of psychosis, schizophrenia or bipolar, current use of MAOIs or SSRIs, uncontrolled cardiovascular, pregnancy or nursing, active suicidal ideation, right? So pause requires caution, current mental health instability, major life transitions, crisis, no support system available, unable to take recovery time, seeking escape or versus healing, family history of psychosis, right? Being honest about readiness isn't limiting, it's protecting your potential for real healing. All right, guys. The hype versus reality gap, managing expectations for informed decisions. So one trip will cure everything. That's like a hype. One trip just cure everything. No, reality. Most protocols involve 2 to 3 sessions plus months of integration. Another hype is it's completely safe and natural. Reality, there are real risks exist. Medical screening is essential. Another hype, the drug does the healing. Reality, guys, is that you do the healing. The substance is just a catalyst. Another hype is it's a shortcut to therapy. Reality, it can accelerate but doesn't replace the actual therapeutic work. Right? Alright, so key takeaways. Real brain science backs this. Neuroplasticity and DMN disruption explains effects. Context is everything. Therapeutic use doesn't equal recreational use. So therefore, it's not the same as you just want to smoke something. No. Integration is where transformation happens. Substance is just the catalyst. So your integration with the therapy. Not for everyone. Honest self-assessment protects your healing. Manage expectation. This is deep work, not a quick fix, right? So what's your next step? Whether psychedelics are right for you or not, the foundation is the same. It's a nervous system regulation. The foundation for any deep work. This is emotional processing skills, handles what surfaces, support community. You don't have to do this alone. So this is just information purpose only, guys. It's not a recommendation. And so what I did, I have my community where I would share information, share guidance. So my community is a school community called Peace of Mind Community. There's my coaching. I do one-on-one coaching there. So for something like this, you would need to seek a therapist or a psychiatrist to get more recommendation on this. What I have done, guys, I have to put together a list of questions that you can ask yourself concerning if this is something you would like to do before you go and speak to a therapist or a psychiatrist concerning something like this. So let me see if I could share my screen here. Okay, guys, so this here is a psychedelic readiness score before you go to a psychiatrist or a therapist to consult about starting it, right? So this is a self-assessment for high achievements. Discover if you're truly prepared for this transformative journey. So I put together this here where you can ask yourself different questions, and a disclaimer that this assessment is for educational and self-reflection purpose only. Is not a medical advice. Always consult with qualified healthcare professionals before considering any form of psychedelic-assisted therapy. Your safety is paramount, and this guide is designed to help you ask better questions, not replace professional medical evaluation. right? So this is just a question just to ask yourself different questions, and you have the point system here. Once you could finish all these questions, guys, you just tally up the score, and it just gives you a sense of, okay, I am literally kind of ready to ask to go now and seek a health professional to actually get this done, right? So just take this readiness score, right? And then if you score really good, then you can go and meet now a health professional who can literally guide you now towards using this form of therapy, right? So download this. All of this is in my school community. My school community is free. You can just join my school community and you will get this for free just to take it, and it's very simple and easy to do. And then now you can get a gauge now if you are ready to go now and speak to a healthcare professional about starting this process. All right, guys. So thank you very much, guys, and I will check you on the next video.